Established in 1999, V Groups began its journey as a specialized service provider in the occupational health services (OHC) sector, operating in the South India region with a base in Hyderabad, Andhra Pradesh. In 2005, the company expanded its offerings to include equipment services, demonstrating a commitment to adaptability and growth. Over the years, V Groups further diversified its portfolio, introducing equipment rentals and comprehensive maintenance services, including AMC, Annual Maintenance Contract, and CMC, Comprehensive Maintenance Contract, for machines. With a pan-India presence and a global footprint in the UAE and the United Kingdom, V Groups has positioned itself as a versatile and reliable player in the equipment services industry.
Welcome to Anaga Health. Avian influenza H5N1, commonly known as bird flu, is a highly contagious viral infection that primarily affects birds but can also infect humans and other animals. The H5N1 strain of the influenza A virus is particularly dangerous due to its potential to cause severe respiratory illness in humans and a high mortality rate. The virus was first identified in humans in 1997 in Hong Kong. Identification and transmission. Avian influenza H5N1 primarily spreads among birds through direct contact with infected birds, their saliva, nasal secretions, or feces. Human cases are rare, but when they occur, they are often linked to close contact with infected poultry or contaminated environments, for example, live bird markets. Human-to-human transmission is extremely rare but remains a concern due to the virus's potential to mutate. Symptoms in humans. The symptoms of avian influenza H5N1 in humans can vary in severity but often include fever, above 38 degrees Celsius, 100.4 degrees Fahrenheit, cough, sore throat, muscle aches, severe respiratory symptoms, for example, shortness of breath, abdominal pain, vomiting, diarrhea, conjunctivitis, eye infection, pneumonia. In severe cases, complications such as acute respiratory distress syndrome, ARDS, multi-organ failure, and death may occur. Precautions and preventive measures. According to the World Health Organization, WHO, here are key precautionary steps to avoid infection. 1. Avoid contact with birds. Limit exposure to domestic or wild birds, especially in areas where the virus is present. Avoid visiting live animal markets or farms where birds are raised. 2. Proper cooking of poultry. Thoroughly cook poultry products, meat and eggs, to an internal temperature of at least 70 degrees Celsius, 160 degrees Fahrenheit. This kills the virus. 3. Hygiene practices. Regularly wash hands with soap and water, especially after handling poultry products or being in areas with birds. Avoid touching your face, nose, or mouth with unclean hands. 4. Use of personal protective equipment, PPE. Wear protective clothing, for example, gloves, masks, if handling birds, especially in professional settings, for example, poultry farms or health facilities. 5. Vaccination. While there is no widely available human vaccine specifically for H5N1, researchers are working on developing vaccines. Seasonal flu vaccination does not protect against H5N1, but it can reduce the risk of co-infection with other influenza strains. Prevention. 1. Surveillance and early detection. Countries must monitor poultry and wild birds for signs of avian flu outbreaks to prevent the spread to humans. 2. Public health education. Raising awareness about the risks and encouraging safe handling of poultry products is essential in reducing human exposure. 3. Animal health measures. Control measures such as culling infected flocks, restricting the movement of poultry, and disinfecting areas where infected birds were found are critical in stopping outbreaks. Treatment. If someone is diagnosed with avian influenza H5N1, early treatment is crucial. Antiviral medications. WHO recommends the use of neuraminidase inhibitors, such as oseltamivir, Tamiflu, or zanamivir, Relenza, for treating H5N1 infection. These antivirals are most effective when administered early, within 48 hours of symptom onset. Supportive care. Patients may require oxygen, fluids, and treatment for complications like bacterial pneumonia or respiratory failure. Hospitalization. Due to the severity of H5N1, most infected individuals will need to be hospitalized for monitoring and supportive care. WHO updates on avian influenza H5N1. WHO provides regular updates on global avian influenza outbreaks, including human cases, to monitor the virus's spread and potential for causing a pandemic. Here are some ongoing updates from WHO regarding H5N1. Human cases. While sporadic human cases have been reported in various countries, most have been linked to direct contact with infected poultry. Risk of mutation. WHO continuously monitors the virus for any signs of genetic changes that could increase its ability to spread from person to person. Pandemic preparedness. Global surveillance and rapid response systems are in place to contain any outbreaks that might occur. WHO works closely with national authorities to provide guidance on controlling the spread of the virus. You can find the latest updates on H5N1 and other flu-related news on the official WHO website under their influenza section. We sincerely appreciate you taking the time to watch our content on Groups. Your support means the world to us, and we are thrilled to have you as part of our community. If you enjoyed what you saw, don't forget to hit that subscribe button. Subscribing ensures that you stay updated with our latest videos, updates, and exciting content. By subscribing, you become an integral part of our growing community, and your support inspires us to create more engaging and valuable content for you. Thank you for being a part of the Groups family. We look forward to bringing you more entertaining and informative content in the future. If you have any suggestions or topics you'd like us to cover, feel free to leave a comment below. Once again, thank you for your support, and we can't wait to share more exciting moments